Hello and welcome to From the Floor on our conference channel. As my team and I walked around the exhibit floor at the Health 2022 conference, I realized two things. Many health IT professionals could not make it this year because of travel restrictions, busy schedules, and other reasons. And many excellent healthcare solutions were ready and willing to help propel healthcare forward. So here we are from the floor for you to see what you may have missed. Right. So we try to have short conversations with each of the people in the booth and revealed what their solution was, what kind of problem they were trying to solve in healthcare, and the subsequent solutions to those problems. So we hope you enjoy this new series. We're trying it out at the health conference. If it works out, we will continue to do it into next year. Special thanks to our conference sponsors, Sirius Healthcare, VMware, Transcarent, Press Ganey, Sempris, and Veritas for choosing to invest in our mission to develop the next generation of health leaders. And now to the floor.
Thank you for having me today. Taha Kass, Hout, Vice President Machine Learning and Chief Medical Officer for Amazon Web Services. In my current role, I work very closely with customers and partners on building innovative solutions in the cloud for breakthroughs and to solve their problems and concrete use cases. So I've been Amazon Web Services now for the last 5.5, 6 years, and we'll continue to introduce new technologies I'm happy to talk to you about today.
Awesome. And what is the problem that you're trying to solve in healthcare?
So before I get into that, perhaps a little bit about AWS. I mean, what is AWS? So Amazon invented the cloud almost 15 years ago, and that's AWS, Amazon Web Services. We're the broadest and most comprehensive cloud platform offering over 200 fully featured services. These are technologies from data centers around the globe. And our mission is to help customers, especially in the health space, to be able to innovate faster, be more agile, and reduce cost. And specific to use cases in healthcare, I mean, they're trying to provide their members or those they serve with better convenient experience that is more personalized and provide high value care for them. And the way we accomplish this mission at AWS is by working very closely with customers. Our work backward culture is listen to the customer, help them answer the right questions, so that way they can avoid pitfalls, especially when it comes to scale and technology and machine learning, but also really double down on concrete use cases and frictions for these customers that we can remove many heavy and differentiate lifting for them so they can care for their patients better and provide the best care.
Awesome. And who at the health systems would you like to talk to, and what do you want to talk to them about?
So the way we work very closely with both customers and partners. Partners are those technology companies or innovators, anywhere from startups to large enterprises or even health systems that work in to solve problems for these customers, whether healthcare or life science industry, around things such as how can they operate better, or how can they better manage the population and predict outcomes or deliver value-based care. In hospitals, particularly in healthcare systems, we work with large hospital systems. For example, Rush University Medical Center, who's building its analytics hub on Amazon HealthLake Analytics to be able to get a lot of information on their population from medical records, social determinants of health, and even measurements such as cardio, metabolic data, to be able to improve health equity for the population they serve and improve personalization for that population. So oftentimes there we're working closely with CTOs, CIOs, CEOs, as well as Chief Medical Officer or Chief Nursing Officers, because we're trying to really double down on the actual concrete use case that they're trying to solve for, whether that's closing gaps in care, or how can you really better manage the population, or how can you find effective line of therapeutics, or predict disease early and improve diagnostics and precision medicine.
Awesome. Are there any use cases you'd like to share with our audience?
Well, I mean, there are a number of use cases. I mean, there are some operational use cases. For example, Harvard Bethesda Deaconess Medical Center leverage the technology we have to analyze medical notes. That's Amazon Comprehend Medical at scale. I mean, this is where they were able in turn be able to structure all that information and improve their operating room of over 40 theaters to be able to operate more efficiently and reduce cost by at least 17 or 18% in the process, and in the end also offer both surgeons as well as nurses triaging and patients better experience and better outcomes. So that's on the operation efficiency. I mentioned the Rush University Medical Center is really trying to understand gaps in care in the population they serve in West Chicago, and how they were able to build a cohort of patients that they were able to track over time and predict diseases early, and that's across the board from early disease detection to prevention. And so that way also understand where gaps in care are and health equity improvements needs to happen, so to double down on those. And we have many other examples on use cases that I mentioned, population health, and I mentioned operation efficiency, but also in clinical trials. I mean, how can you recruit patients to the right clinical trial efficiently and more effectively? For example, Fred Hutchinson Cancer Institute was able to analyze all their unstructured data using Amazon Comprehend Medical to be able to, where they were analyzing 11,000 charts per hour, and that in turn has improved the case identification and be able to identify the right people to the right trial and improve that efficiency and adherence throughout. And today, AWS introduced two new technologies. One is Amazon Health Lake Imaging, to be able to help healthcare providers and partners to store, access, and analyze medical image data at petabyte scale in the cloud, with fast sub-second image retrieval in your clinical workflow, while ultimately reducing the total cost of image storage by at least 40%, which is quite significant. But here's also the great thing is hospitals can integrate their existing medical viewers, image viewers, as well as analysis applications with Amazon Health Lake using a single copy of encrypted medical image data, which that also plays a critical role where we don't have to have many copies of the same data, and you both clinical and research systems and all these solutions trying to access that information.
Wonderful. Thank you so much.
Thank you so much.
My name is Neil Sharma. I'm the Executive Vice President for all the strategic channel partnerships. And Sword Health is a company that is working to free 2 billion people from pain, physical pain. So we pride ourselves on knowing that half of the world lives in some kind of a physical pain. And so we work with them exclusively on a bespoke solution, a personalized solution. We have a 3-pillar system. You get your own PT, and it's a digital remote MSK service, and we give you a very specific device that collects information and data for you, and then we create a program that is exclusive to you, because not all back pains are the same, right? Not all knee problems are the same, and not how you address it. Now, the reason we use a licensed doctor of physical therapy is because if anyone gets injured in your family, God forbid we get injured, the first thing that our primary care physician or a surgeon will do is send us to a PT. They won't send us to a health coach. They won't send us to a life coach. They'll send us to a PT who's licensed to understand your body, your musculature, and so forth. So Sword is working to go to that mission.
And who at a health system would you like to speak to, and what is the conversation that you'd like to have with them?
So we'd like to speak to, and we are speaking with, a lot of the health plans today who are offering different mechanisms for digital MSK solutions. We are talking to employers, right? Self-insured, fully insured employers. We are talking to actual customers and members, right? Ultimately, it's the person who is working. It doesn't matter if it's a 9-to-5 job, it doesn't matter if it's a blue collar, white collar, it doesn't matter if it's in the warehouse, behind the desk. We all seem to have the same problems, and those problems can be addressed, but they have to be a personalized solution, because our journeys are different, the length of our journey is different, the way we go about it is different. The most beautiful part about everything that we do at Sword is, it's done on your own time. So 60% of our audience uses our solution between 8 p.m. and 4 a.m. in the morning on their own time.
Do you have any use cases you'd like to share with us?
There are a number of use cases. There are people that have written into us, but I'll give you a personal use case. I have a knee problem, and when I came to Sword, I immediately got into the program, and I spoke with my PT, and she realized that my gait is a challenge, so it's actually my right hip that is also causing my left knee a problem. And so we had to work on correcting my gait, correcting strength of certain muscles. And so today, I'm pain-free.
So we're Onduo. Duo is a digital health platform and a population health management solution for chronic disease. We are part of Galagali, which is part of the Alphabet Big Google family.
Beautiful. And what is the problem you're trying to solve for healthcare?
I call it the dark matter problem. I actually used to work at a health system. I was an executive at a health system, and one of the things that we miss when we think about the electronic health record, we think about claims data, we're missing a lot of the data that people have about their lives in chronic disease. All that happens in the 365 days of the year, or actually maybe the 363 days they never encounter or in the clinic or with a PCP. How do you capture that information? Blood glucoses, blood pressures, things like that. Well, obviously with mobile technology, there's an opportunity to collect those signals. And then by collecting those signals, we have a lot more relevant signals for how we can take care of people with chronic disease. So that's what I call the dark matter of health.
From a member perspective, the ultimate value is the empowerment to know that chronic conditions don't have to determine you. You can have control over how you take care of yourself. So getting that data, real-time data, plugged into your mobile phone, seeing how Fitbit or your Apple Watch even integrates into the phone to tell you the steps you've taken, getting real-time consultation on foods you're about to eat, coach, and ultimately getting access to an endocrinologist, which is so hard in this country. So making a lot of that easier and ultimately driving more adherence to your medication, if that's the system that you end up going down, helps reduce the cost for any organization that's trying to manage this chronic care and helps empower users in a really meaningful way.
And who at the health system would you like to talk to, and what is the conversation you'd like to have with them?
I think it's talking with the chief medical officer. Often now they have a senior population health clinician. Like I said, there's so much data that we miss. And if you're trying to take care of chronic disease, how do you take care of it when your people only see a PCP or get their labs drawn a couple times a year? I think that's where we can fill in the blanks for traditional health.
And there are times when at health systems, the tech and innovation team can help drive some of the learning for people that are still trying to get awareness over virtual care and chronic care. And so the tech and innovation team can help usher that conversation forward with pop health and the other groups. Any of those folks would be great.
Hi, I'm Charlie Lougheed. I'm the CEO of Axuall and co-founder. Axuall is a workforce intelligence company. What does that mean? That means we bring data about clinicians to health systems so they make better decisions about how they deploy the most critical talent and workforce in a way that is optimized, reduces attrition, and ultimately meets patient needs.
What's the problem you solve for healthcare?
What's the problem we solve for healthcare? Access to information. Information is really key. When you're making decisions about where to place clinicians in the field, whether or not you're a large health system or a staffing firm, you need to be able to understand what capabilities exist, how they can be deployed, what gaps can be filled, where and how, and information is at the core of that. It's something health systems have missed for a long time, and we're helping to bring that together because you can't necessarily manufacture jobs or physicians that can only do that so quickly, but having the right information to place them efficiently across your enterprise is something that we focus on and bring to the market.
Who do you want to talk to at a health system, and what's the conversation you want to have?
Ultimately, it's typically with the people who are in the C-suite because they're dealing with some of the biggest problems they've ever experienced or their peers have experienced inside of healthcare. You've got double-digit growth in need combined with double-digit attrition and issues relative to all the different kinds of challenges that health systems are facing today. So typically it's going to be a chief operating officer, chief HR officer, sometimes the chief medical officer, but it's those people that are charged with building a world-class environment of clinicians that isn't burnt out and that matches the demand that's coming at them.
What a great group of healthcare partners. We want to thank them for spending some time with us on the floor and sharing their aspirations, their solutions for healthcare IT. I want to thank them for talking to me and talking to Holly and talking to our team on the floor. We also want to thank our conference sponsors who are investing in our mission to develop the next generation of health leaders. They are Sirius Healthcare, a CDW company, VMware, Transcarent, Press Ganey, Sempris, and Veritas. Thanks for listening. That's all for now.